Bogarai Ishkuji and Dara Sankash in Chocta Colin Burke to discuss the waiting time for the allocation of home care hours to applicants in the Cork region.
Thank you very much, Lasca Cola. Minister, this matter has been raised with me by both families who have elderly parents or relatives trying to get home care, and also by commercial providers of home care. And they find that the number of hours being allocated and the way it's allocated there's quite a long delay. And where it has come to light with the commercial sector is that where someone has been looking for home care, and then when the HSE seem to have exhausted their efforts to find someone who is working with the HSE to provide at-home care, that then the private contractors are then contacted, and they're finding that the person has been waiting for quite a while for a decision to be made about the provision of home care. And I suppose just to give you the figures, Minister, as I understand it, during the very difficult period of time when there was COVID there, the HSE in the South West Hospital Group area had over 1,800 home care providers. I understand that once COVID ended, and I suppose we were all delighted to see the end of it in real terms, over 400 people decided not to work in that area any further. So there was a drop of 400 out of 1,800. And I know that the HSE have worked very hard to get replacement people, but my understanding is that they haven't been successful. While they have replaced some people, they haven't replaced all of the 400. Therefore, there is now a reduction in real terms of the number providing home care within the HSE. That therefore raises the issue about the need to go to the other providers, and there's a range of, I think there's well over 20 different providers of home care, and they're finding that they're being contacted at a far later stage. And I suppose if you want to get people out of hospital in a timely manner, then families are reluctant to take that risk of having people coming home unless they know there's a support package in place. And I know that in some areas, and in fairness to all of the HSE staff, both in the hospitals and out in the community, do work extremely hard, but there still seems to be a disconnect as regards how we can get a better coordination of the services and delivered in a timely manner so that people get the home care that they require, but also that is put in place at the earliest possible date. And the other issue that I have is the hours allocated. In some cases, I'm finding that the hours allocated aren't sufficient, even though there are people available to provide the hours. And I had a number of cases recently where that occurred, and when I did make representation on it, it was followed through. But I don't think it should be up to families or relatives to have to come to a public representative to have the number of hours increased. And these are genuine cases where, you know, you're talking about elderly people who required living on their own, who may not have immediate family living close to them, but they need someone coming in not just once a day, but at least 2, if not 3 times a day, to make sure that they are adequately looked after, both in respect of meals, but also in respect of in relation to the care that they require. So it's in that context that I'm raising it, and it's in relation to the South West Group. My understanding is that the private sector is contacted at a very early stage in all of the other group areas except in the South, and therefore, as a result, where the HSE don't have the staff to provide the care, there's a delay then in providing that care as a result.
I thank the Deputy for raising this issue, and it's such an important issue for everybody in this House and the people whom they represent. A key focus of the Sláinte Care Reform Programme is recognising and facilitating, enabling older people to age well at home and in their communities for as long as possible. and improving access to home support is therefore a priority for the Government. Since Budget 2021, we've provided about 230 million in additional funding for that service, and the preliminary data indicates that over 22 million hours of home support were provided in 2023, which is more than has ever been delivered, exceeding the HSE's target for the year. Of course, that is very, very important, but it does require good management, and the Deputy correctly highlights some of the difficulties that TDs hear about, including difficulties I might hear about myself in my own constituency. And so it's very important that we have a continual focus on the management processes of these things. The HSE has reported that in Cork and Kerry there are currently 8,293 people at home support service, with over 33,000 hours of support being provided. In Cork Kerry Community Healthcare, 75% of the service, I'm told, is provided directly by the HSE, with 25% delivered by external providers. Of course, the Deputy's question is about the process by which the request is advised to private providers in the case where the HSE cannot provide it. I'm told that the HSE advises when a request for service is received. It tries to, in a priority way, identify the availability to deliver that support, and where a request for home support will always also be sent to private providers if the HSE does not have available staff to allocate that service. But of course, the Deputy correctly raises, is that done within a day? Is it done within a week? Is it done within 6 weeks? Because all of that is time mounting for a family with somebody who needs very specific care. Now, I am told by follow-up queries to the Department, and I'm grateful to them for that this evening, that the HSE that this can happen on the same day, but it typically happens within the week. The HSE provides CHO-specific lists of approved providers and asks clients to indicate first if they have a preference. If they don't, the HSE issues an email alert to all CHO providers in that CHO, and the first one to indicate availability gets the work. So I think that's just a little further clarity in relation to it. It is important to point out that both the HSE and private providers are currently experiencing similar recruitment and retention issues for staff. It is a priority for the Government to try to bring more people into this country to address the shortage of care workers, and it is a key challenge for the Department of Enterprise to make sure that the that can happen, and indeed for Minister Simon Harris in terms of apprenticeships and bringing people into different pathways so that we can meet the needs that are there. Efforts are continuing in Cork Kerry Community Healthcare to increase capacity by recruiting staff, and since the introduction of the current recruitment phase, derogation has been sought and granted for 49 healthcare assistant staff, but of course those people have to be available to be able to be hired. Again, I'm told this evening by the Department, and I'm grateful for their answers to my follow-up queries, that September 2023 figures show that there were 1,495 HSE home support staff in the Cork Kerry CHO, which is CHO4, which is 929 whole-time equivalents, and I'm told that that is the highest of all of the CHOs. So just to provide a little extra clarity to the Deputy, but this is a question of management and quick responses to constituents. There is no doubt but that we need to continue to rely on private providers where we're not able to meet the need within HSE, but those private providers have an obligation to respond, and to respond quickly and efficiently, and to make sure that the care is met as soon as may be.
Thank you, Minister. I think the answer kind of confirms what I was saying. For instance, you're talking about 25% is provided by the private sector. My understanding is that in other areas it's far higher than 25%. And again, Minister, the concern that I have, the fact that it is confirmed that only 25% is provided by the private sector, when I said to you, you know, go back 3 years ago, there was over 1,800 people working in the HSE providing home care. It's now over 400 people left for various reasons, because it was a very tough time for anyone providing home care during the COVID period. But you've confirmed to me that in fact there's now only 1,495. So in fact, all of the places that became vacant haven't been filled, yet we're still only bringing in the private sector in 25%. And I'll give you one example, Minister. I had a case where someone was 90 years of age, living on their own, have to use a walking frame to move around their own house, and all they got in home care was 1 hour per week. And I think that this issue needs to be reviewed by the HSE in the Cork Kerry region. Can we provide additional hours by engaging with the private sector, and also making sure that we can provide them in a timely manner? Because remember, the cost of a nursing home place, the cost of a nursing home bed, within the HSE is €1,800 per bed per week. Provided by the private sector in a private nursing home is around €1,150 per bed per week. You could provide an awful lot of home care for €1,800 per week. And that's why I'm saying that, therefore, where people need additional hours, we should be trying to provide them in order that families don't have to make the decision, well, the only option is Mary or Michael or Pat has to go into a nursing home. And I think it's really important that we work towards getting the additional hours and getting the support for people to keep people in their own home for as long as possible.
I agree with the Deputy, and I think it's important to highlight that, notwithstanding I'm saying that this is the highest number within all of the different regions, we're still not meeting the need. And so where we recognise that there are recruitment challenges both for the public and private sector, the emphasis on management of resources and the management from the perspective of the user is so very important. An hour a week appears to me to be grossly an undermet need. And indeed, I stood in a constituent's house this week myself, looking at the schedule, the care schedule for a gentleman in Kerrysford Downs in Blackrock, and I looked at all of the different carers who were coming in, 5 and 6 different carers every day. This man is at a period of acute need in his life. But to look at the management processes, there's some carers who come 2 or 3 times a week, but there are 5 or 6 different people a day, and you have to wonder about the management of that, given the scale of resources to the private provider that's being provided. From the perspective of this gentleman's wife, the absence of the continuity of care for her in being able to make sure and having to explain every time what's different and different and different. And you do sort of wonder about this cost being put into this and the customer service or the client focus that's being delivered. It does seem curious that you need so many different carers for a single individual, and that they can't be rostered in a way that provides the best continuity of care and the best support and the best relationship development. So there are questions around the management of this, I would wonder, and again, coming to it always from the perspective of the person's need is by far the most important thing. I think we are struggling with the recruitment challenge. I think it's very, very important that we have people in this country to be able to meet the needs. So if we want to have people at home for as long as possible, then we need more and more healthcare assistance. I'm afraid this is linked to their questions of migration that come up again and again, and this issue is important in highlighting that, as with a growing population, with a population that is ageing more and more, that will need greater need, we need more people in this country who are going to be ready and available to provide the sorts of services that you and I would like to see for our constituents.